My name is Rebecca Fein, and I am going to walk you through my master's thesis, which is called When Leadership Goes Bad. And you can see me down here in the corner, hopefully, anyway. If you can't, there must be something wrong with my settings. And hopefully somebody watching this will email me and say, hey, we can't see you. So I submitted this as partial fulfillment for my Master of Science in Applied Health Informatics degree from Bryan University, and Dr. Chris Yule was my thesis mentor. So the overview of my PowerPoint slides consists of the summary of the case, problem statement, diagnosis, causes, 7 perspectives, and also recommendations, which I left off of this overview slide, but the last slide is recommendations. Also, on the 7 perspectives, we have project management, operations management, quantitative reasoning, policy, financial impact, leadership, IT, and then the recommendations section that I mentioned. In the summary of the case, this is the case of Care Group, which was a group of hospitals in Massachusetts. By the way, nobody is named in this presentation or in the actual paper because I did not want anyone to feel attacked. This is based on an actual real case. So in 1996, there was a merger, and in 1998, a new Chief Information Officer was hired. In 2000, the CIO, the Chief Information Officer, had expanded responsibilities at Harvard. I believe he became the Dean of their School of Medicine, and some other responsibilities were given to him. In 2002, the employee who was known as the network guru left Care Group. And then in 2002, there was an incident with a Napster type program. And what happened was a tech was testing out a new program, which was this Napster type program, and the person ended up having a family emergency. His wife was in labor, and so he left this program running and forgot to inform people that it was running, and he ended up setting a chain of events in motion that resulted in a 3-day outage for their network, which brings us to my next slide here. In 2002, those network difficulties were reported that I mentioned, and then the CIO waited for 24 hours before he called the vendor, which was Cisco in this case. And then it took 3 days to recover the network. 3 days is an eternity for an organization to be without its network. The problem statement is a failure of leadership to declare a disaster, and that's specific to the IT leadership. They failed to declare a disaster. They failed to recognize they had failing infrastructure and mitigation steps. They failed to put into place mitigation steps, and then there was a generalized leadership failure because leadership did not step in to help with this particular situation. So the diagnosis is a network outage lasting nearly 3 days, and a lack of succession planning because there was nobody cross-trained to step into the shoes of the network guru when he left, inadequate IT resources, inadequate operation controls, and poor communication of policy and procedure. And those are all issues that came together in a perfect storm. So some possible causes, and of course there could be more than these, but here were the ones that stuck out to me. So the Chief Information Officer did not ensure policy and procedure was in existence. There was a lot of talk in the case study about lack of standards, which I mentioned later on in this presentation. So there was no mechanism in place to ensure policy and procedure existed in the first place. The policy and procedure that did exist was not clearly communicated to personnel. The network guru was not replaced, which goes back to what I said about succession planning. The CIO had no enterprise experience, which may or may not be significant. And there is a lack of monitoring of the network. Also, in addition to those that were more specific, you had generalized organization demonstration of dysfunction during a crisis and distracted leadership. And this all, again, came together in a perfect storm to cause a failure of the disaster recovery policies. From a project management perspective, measures were in fact taken to mitigate the events. Obviously, the desired outcome was network restoration as soon as possible. There was a delay in the team assembly, but there was good problem-solving strategies and good functionality once the team was assembled. From an operations standpoint, there was no defined process for diagnosis of the network. Also, they treated the symptoms, not the causes, and there seemed to be many processes that did not work here. The disaster recovery process, the team assembly process, they're just a mess. Also, there was a problem of operations controls. Why was somebody allowed to leave something running for 3 days and nobody knew about it? That's a problem. How come nobody, let the vendor know prior to 24 hours of network difficulty? Again, problems. For quantitative reasoning, here are some points that I pulled out. So internal data being data from care group, external data being data from outside sources, vendors, hospitals that were not affiliated, maybe the State Department of Labor, Federal Department of Labor, however you want to look at that. The network analysis would be also data. Oops. That could be included. And from a quantitative standpoint, the most important point was the one on the bottom of the slide. I'm not sure how to go back while recording. But the bottom one where I talked about the comprehensive review of the data. It's all fine and good to collect this data, but you really have to find something to do with it and to do some action, which could go actually very nicely to your internal policy issues that I have mentioned here, because that's an important aspect. So federal regulations obviously were involved in this case. This is back in 2002, so the only big one was the Health Insurance Portability and Accountability Act, which is HIPAA, of 1996. They were fully compliant. They did have some internal policy issues and communication issues, which I've sort of already talked about. One being, again, what do we do with this data once we have it collected? And how do we communicate those ideas? Financial impact was really very negligible given the size of care group. It mostly consisted of the cost of lab tests. There were 300 lab tests that they were unable to perform due to this crisis. Lost productivity was also another impact because you had staff that couldn't do their jobs in your lab, for example, so that was an issue. Leadership is really the biggest perspective to look at when looking at this case. There seemed to have been some merger and cultural changes that resulted in challenges. You see that when the new CIO was brought on in 1998. You see that again when there's no standards in 2002 for some of these aspects. That culture clash then created policy and procedure challenges. And of course we have allocation of resources and capabilities. Who are your personnel and where are they? And dysfunctional team dynamic, which is not helpful to anybody. And then of course you have the hands-off approach and invisibility of leadership, which is a real problem, because if you are not out there as somebody in a position of leadership, your underlings feel like, why should they be out there? So that's also an issue. From an IT perspective, there were issues around change management. Again, going back to, you didn't have any standards in place. You had a new person that came in 1998. You didn't replace people. How do we manage these changes? What are we doing? Business continuity is also an issue because they were out for 3 days. The currency of documentation and procedures, we're not sure if that was really an issue or not, given the information in the case, but it could be. Testing environments certainly was an issue here, because the person was testing in a live environment for whatever reason. And again, we go back to the policy and procedures were not being standardized. So recommendations. Leadership role in disaster examined. This is probably the biggest one. I can't stress this enough. The leadership involved in this situation really need to look at what went wrong and what was their role in that. Also, solutions need to be examined. What worked, what doesn't work. Operations needs to look at processes. Policy needs to be documented, communicated, and enforced with sanctions. I don't know that this employee violated a policy, but if he did, he needs to be made aware of that. His actions were very expensive in terms of time and effort for people. Maybe not necessarily money, but certainly time and effort. IT governance improvements certainly need to be made here and examined. I don't know if IT was an island by itself, but that is certainly something that needs to be worked on. Also, policy and procedures need to be current. Again, I'm not sure if they're not current, but that's certainly something that needed to be examined. And again, clearly communicated, relevant, and enforced. If they're not relevant, it doesn't matter if they're clearly communicated. If they're not enforced, it doesn't matter if they're clearly communicated and relevant. So everything kind of goes together in a trifecta there. And resources need to be reviewed for adequacy. So I'd like to thank you for participating in my experiment with this software, and I will